A skilled chef already knows how to cook, but when they join your Italian restaurant, you still have to train them on your specific recipe, the presentation style, and then your menu. This is not them learning how to cook, but learning how to cook your own way. This is exactly how we fine-tune AI model. We pick one of those foundation models and we cook it into an expert within a domain, and we let it solve business problem within that domain. That's why the source and the quality of the data are very important to us. If we are seeing for the first time, this is day 2 of me talking about AI value chain, data sources. A health tech AI startup in the UK had built its model on top of data from the National Health Services, NHS. And in 2 years' time, the NHS has gone on to say, no company should use our data to train an AI model for regulatory reasons. What do you think is going to happen to this startup? They are cooked already. This is what investors ignore most times when they want to invest in a company: data governance and regulation. If the data is not defensible enough, you're going to be in trouble. Back from there, when we fine-tune a model, we get data in 5 ways. It could be raw data, structured data, unstructured data, sensor and IoT data, and proprietary data. I give you an example of a legal tech AI business or company trying to automate workflow for law firms. How do they get raw data? They get it from case laws, from regulatory filings, and a patent data. An example also, how do they get structured data? They get it from a time log, billing data, and legal ontologies. How do they get unstructured data? From contract emails and filings. Then sensor and IoT data. This is not common in legal, but then there are some forensic use cases for sensor and IoT data. Then proprietary data. Law firms, especially those that have been in the industry for a very long time, they have good proprietary data over the years. Then another example is a healthcare AI trying to automate workflow for operation within a hospital. How do they get raw data? They get it from research articles and from clinical guidelines. Then how do they get structured data? They get it from EMRs, lab reports, claims data for insurance, and drug database. How do they get unstructured data? They get it from clinical notes, imagery, and a patient's feedback. Then how do they get sensor and IoT data? As you know, the hospital is full of so many equipment and machines. The log of that machine can also be used to train AI models. Then for a proprietary data, a good number of those long-standing hospitals have good proprietary data. This is an example of how you source quality data for your AI use cases, not some random data free all over the internet.